Tell me how you use this technology in sports injuries.
Well, we've actually, over the years, developed a practice of clinical nutrition and bioenergetic medicine and rehabilitation. And so we've seen everything from very young athletes having acute injuries, twisted ankles, shoulder sprains, repetitive strain injuries like from throwing baseball, playing soccer, doing gymnastics, very strenuous activities that in these younger bodies can lead to chronic injuries. And we've utilized various modalities, nutrition, low-level laser, other types of stimulation devices. But since I've been introduced to and been using the Avazzia units in all their various forms, we've had just unprecedented success in resolving these injuries and preventing re-injuries by minimizing inflammation and restoring normal function.
The repetitive use of hands or any other joint many times can cause inflammation in the median nerve, which is the main nerve that supplies half your hand.
Right.
And so with this repetitive use, you have an inflammation in a small tunnel, it's like tunnel, that's what's carpal tunnel, of bone where the nerve has to go through. So as that nerve swells up from the inflammation, puts pressure on the nerve, causes the nerve to dysfunction in a sense. So you experience pain in your wrist, you experience numbness, you experience weakness, and so it's a major problem both from a financial and a human suffering point of view.
How's the test going?
Well, the reason for doing the testing is we want to do a formalized FDA guided study so that we could prove conclusively that this device is really effective. And in order to do that, you really have to do it on a double-blind, it's called double-blind crossover method, which means that you divide up your subjects, your patients, into half group gets the real device, that's an actual device. The other is a sham device, even though it has a little bit of a signal, so they can't tell the difference. I don't know the difference. And so we do that for 30 days. We give them a break. And at the end of 30 days, the people that had the real device now have the sham device and vice versa. So this way, by doing consecutive measurements on nerve function, on images within the tunnel, and a whole group of medically accepted tests, we can prove conclusively to FDA's satisfaction that this is truly effective, because anybody can say this works, and a lot of people have had great success, but when you come down to that kind of a study, you're really proving your point.